Yoga teachers need to stop playing doctors. They're not doctors. You don't know what you don't know. Even though I know at the end of the day, with most patients, I'm going to be telling them the same thing, which is that pain is okay during exercise, I still have to do a full exam, full history, ask them about their red flag questions, social history, review of systems. I still have to do all of that because you don't want to miss something that is really life-changing and life-threatening, potentially. Hey, this is Anthony Davis with Shapeshift Wellness. In this episode, I want to explain why I think that pain science education for yoga teachers and personal trainers or any movement professional who does not have a license in healthcare is I think it's risky. I think that it can be done effectively, and we'll explore some of the reasons why pain science education is important, but also why it's potentially harmful to the students even, but also to the teachers themselves. So let's get into it. So just a quick background on me in case you don't already know. I am in my 9th out of 10 trimesters of my Doctor of Chiropractic degree, and I'm a student clinical intern, and I am treating patients on a regular basis under the license of another doctor. And so I'm seeing patients constantly and rehabbing them with exercise. Mainly my focus as an intern is to be able to help people find strategies to move effectively and use exercise, things they can do on their own, to rehab and get healthy again. That's my focus. As a consequence of that, I deal with people who are in pain constantly and how to find exercises that are appropriate for them. Sometimes pain doesn't matter during exercise. It's totally safe. In fact, most of the time, for most people in most conditions, pain is just not a big deal. However, when yoga teachers and personal trainers start learning about pain science and they realize that pain usually isn't a big deal during exercise for most musculoskeletal conditions, even neuromuscular skeletal conditions, I should say, they start playing doctor. And yoga teachers need to stop playing doctors. They're not doctors. You don't know what you don't know. So let's explore some examples. If somebody has back pain, which is the chronic nonspecific low back pain accounts for it's like 98% of low back pain out there. So 98% of the time, if somebody has low back pain, it's not a big deal. And you can, just give them encouragement and advice to remain active, and it's usually not a big deal. However, in terms of safety, it's not unsafe. It's disabling. It's the largest cause of disability in the entire world. So it is a big deal, but it's not unsafe to exercise if you have chronic nonspecific low back pain. But what I just said there, chronic nonspecific low back pain, is a diagnosis. That's specific. It's actually not specific, and there's a whole debate among clinicians about specific versus non-specific pain. I'm not going to get into that. But the point is that it is a particular diagnosis, and although most people fit into that, any good healthcare provider has to, before they give that diagnosis and can safely give the advice to, yeah, you're good, you're healthy, movement is safe, get out there, kid, you're gonna do great, movement is safe. Before they can give that advice and say, even if pain occurs during activity, that's okay, and we can start using tools like a pain traffic light and a no worse principle that we use in clinic all the time, which is essentially saying pain usually isn't a big deal. It's okay to have a little pain during activity. Before you get to that point, you have to do a whole patient initial exam, and that involves taking a full patient history. That includes their social history, a review of systems. So we talk about all the systems of the body, ask about red flags, yellow flags, other kinds of flags. We have to perform a physical exam, a neurological exam, a An orthopedic exam is most common, especially for musculoskeletal complaints. So those types of things have to happen first. And then, yeah, most of the time at the end of all that, we do end up saying, hey, it's not, if you have pain during activity, it is safe. You're not going to damage yourself. In fact, we want to, encourage that we progress your exercise and introduce more load and make you really strong. And in that process, you might feel some soreness. Even though it feels like a little bit of pain, not a big deal. Even though that's most of the time, the fact is that somebody else, even if it is just 2% of the time, that somebody can come in and say, I have low back pain. If I tell them, oh, you're fine, don't worry, exercise is safe, no big deal. If I jump the gun on that and I don't do a full history review of systems, ask about red flags, do an orthopedic exam, those kinds of things, most of it actually comes from the history. So you gotta know which questions to ask. But if I don't ask them about things like pain that wakes them up at night, are they having fever, sweats, chills, pain that doesn't change with position, if they have night pain that's relieved by aspirin, those kinds of things. If I don't ask them about things that are stereotypical of, for example, cancer, for example, some types of cancer that eat away at the bone, and even though it presents as a dull ache, they might say, oh yeah, it's just this dull ache, no big deal. If I jump the gun and say, you're safe, no big deal, go exercise, they might have a destructive bone lesion that eats away from the inside of their bone and makes it easy to fracture that bone. And my advice to say, no, go, it's fine, go exercise. Even light exercise with minimal pain could cause a fracture in their spine, right? Now that's an extreme example, but it does happen. It can happen. Pathological fractures do happen, and that happens when the bone is eaten away from the inside by some type of metastatic or some kind of lesion that is cancerous, essentially. And if we just say, go out, yeah, it's fine, go play rugby. Come on. We don't want them to have a fracture. So that's an extreme example. Other examples that are much more common is, oh, I've got a little bit of pain, a little numbness, tingling in my arm or something like that. Hey, no big deal. Go exercise. Yeah, you know what? That would be good advice for most people. But if you're not a clinician and you don't take a full history, do a full exam, and you don't know what you don't know, and you don't have a healthcare license, if you just say, no big deal, keep exercising, you might miss the fact that the reason they're having numbness and tingling isn't because of some nerve thing that has to do with mobility. And you say, we'll just stretch it out. We'll just stretch it out because you learned about nerve glides and now you think you're a doctor. Even though that's okay most of the time, the fact is that it's not uncommon for somebody to come in with numbness and tingling, and that's diabetes. That's a peripheral neuropathy, a diabetic neuropathy. That's a multiple sclerosis, or ALS, or Lyme's disease, or something like that, right? Or it could just be vitamin B12 deficiency could do that, or folic acid deficiency. So there are a number of things that have nothing to do with stretching and all that if you are exercising, no big deal. Or what if somebody comes in with calf pain and you say, hey, no big deal. Yeah, you've got a little pain right there in the center of your calf and it kind of hurts when you take a step. No big deal. It's cool. Let's continue to do Utkatasana and our lunges, and let's do squats and things like that. Let's just continue to exercise because it's just a little bit of pain, no big deal. What if they have a thrombophlebitis, which is like a giant blood clot in the calf that if you dislodge it by exercising too much, using the calves too much, it can dislodge this giant blood clot in the veins of the calf and cause a pulmonary embolism. Right? So again, I'm definitely bringing up dramatic examples, but I'm just trying to give you an idea of like what can happen. When does pain matter? Sometimes pain is really, really important, and it is really important that we do not exercise yet. Fix the problem, then go exercise. But that's why you send them to a doctor. That's why yoga teachers and movement teachers should not be talking about pain. Even though, and I get it, it's so frustrating, but most of the time pain doesn't matter. It's okay. It's okay to exercise with pain. It's safe. We should stop noceboing people. We should stop scaring them about pain. Maybe we can do that without having to talk about pain. Maybe instead of saying things like, if you reach over your head and you don't externally rotate the glenohumeral joint, you're going to cause impingement, you're going to cause a rotator cuff tear, you're going to have problems later in life, you're going to degenerate your shoulder, and that's going to cause chronic disability. I'm not making this up, okay? I used to, even as a yoga teacher, talk about how, processes of degeneration might happen in the shoulder. And that was way inappropriate for me to do, right? But there's no accountability for yoga teachers and personal trainers. There's no regulatory board. There's no license that they can have a strike against. There's no license that they can revoke or suspend, right? They can say whatever they want. Please stop playing doctor, but also avoid no-sebic language. Don't scare people. If somebody has pain, don't start saying, oh my God, that's terrible, you're gonna blow out your knee. Just work with them. Yoga teachers and personal trainers can become experts at finding pain-free ways to exercise. And that is a really unique and valuable skill set. Even though most of the time it's okay to have some pain during exercise, it's just more enjoyable to exercise without pain, right? So can we at the same time say, let's not scare somebody about pain. Let's also not talk about their pain. Let's not give them guidance on their pain if we don't have a healthcare license. But also, can we perhaps work with them on strategies to find less painful ways to exercise? So if somebody comes into a yoga class, all right, here we go, takeaway, practical takeaway. Here's something you can do in your classes if you're a teacher of some kind. Somebody comes in, they have back pain. Yeah, 98% of the time, not a big deal. It's okay, it's safe to exercise with pain. But what you can do without a license is to say, okay, it hurts when you do a forward fold. All right, might not be a big deal, and it might be safe to continue to do that. But for the purposes of this class today, let's say this person's name is Susie. Okay, so Susie, hey, so that hurts when you are trying to touch your toes. For today, I don't want to start freaking you out about pain or anything like that. And really, I don't want to get into pain, but for the purposes of our class today, let's try to have a more enjoyable experience by exploring all of the amazing movements that you can do that don't evoke this sense of pain. Not necessarily because pain is a bad thing, or not necessarily because pain indicates damage, but just for our purposes today so that you can have a more enjoyable class. And then, as for pain, if you have a physical therapist or a chiropractor or something like that you can work with, please let me know what they say and let me know if they clear you for exercise. But for today, let's explore all the amazing things that you can do that don't cause you discomfort, right? And then maybe that's just a more enjoyable class. And I just sort of ad-libbed that, and so I'm sure there are much better ways that you can phrase it, but I hope that gives you some ideas, and I hope that teaches you a little bit about pain, when pain matters, when pain doesn't matter, and why, if you're a yoga teacher or a personal trainer, even though pain is usually safe during exercise, you should still not be talking about it. If I, as a future clinician, as a future doctor, and currently as a clinical intern, have somebody who come in with pain, even though I know at the end of the day with most patients I'm going to be telling them the same thing, which is that pain is okay during exercise, I still have to do a full exam, full history, ask them about their red flag questions, social history, review of systems. I still have to do all of that because you don't want to miss something that is really life-changing and life-threatening potentially, okay? Go learn the pain science, but keep it in perspective and don't play doctor. Thank you so much for watching. I hope if this was useful, subscribe if you made it this far, if this wasn't too ranty. Was this okay? If somebody's still watching, by the way, thank you. And should I do more videos where I just talk about relevant subjects? Are these useful? I don't know. Let me know. See you next time. Peace.